Well, new tonight, an audit of Oregon's Measure 110 experiment paints a grim picture of the program and how it's falling far short of its goals. Many will remember the measure that decriminalized possession of hard drugs in an effort to tackle addiction with a public health approach. Well, that part of the Measure 110 experiment ended when drugs were recriminalized last year, but the measure continues to fund programs related to substance use, and those too are under the microscope. Oregon's Measure 110 has been highly criticized since it passed by voters in 2020. On Wednesday, a new audit released by the Oregon Secretary of State's office found overall it's not reaching its goals. Here's Secretary of State Tobias Reed.
We found a lack of consistency, a lack of data, a lack of long-term planning.
The audit gave the Oregon Health Authority 6 recommendations, including building a roadmap with timelines and accountability, requiring all providers who get money from Measure 110 to regularly report data, and come up with a better way to measure progress.
The biggest thing, I think, is the question of urgency. This is an emergency for the state. People are dying. Businesses are suffering. People don't feel safe.
The Oregon Health Authority accepted half of the recommendations.
But the disagreement really comes with the ability to implement. So we don't want to make false promises that we can't follow through on. And
Abby Stamp at OHA says comparing data from the start of the program to now isn't currently possible.
Unfortunately, the data that are available during the time period that we would be doing the baseline analysis, approximately 2019 to 2023, don't provide a standard that our analytic subject matter experts would feel comfortable establishing baseline for.
The audit says without action by OHA to address governance, integration, and accountability, the program has little to no chance to fully deliver on its promise to help Oregonians struggling with addiction. Another challenge, the number of times state lawmakers made changes to Measure 110.
If you're changing direction constantly, it's hard to get where you're trying to go. And I think this is an example of that.
And it would be really fantastic to have the opportunity to be able to stay the course, to firmly plant a North Star in the sky and to head in that direction.
In a statement responding to the audit, House Republican leader Lucetta Elmer said Measure 110 was sold as a compassionate public health approach. Instead, it became a system with no clear direction, no meaningful accountability, and no urgency, even as overdose deaths continued to rise. This was not a failure of compassion, it was a failure of leadership.
Measure 110 was a label. It carried a really negative and sometimes a false negative narrative, being blamed for overdoses and the fentanyl epidemic. And lots of research has disproved that. And I see a pathway of opportunity ahead. I've got a really strong team of folks and incredibly dedicated providers, and we've got declining revenue ahead of us and more tumultuous waters to navigate together. But we know these services do good for people in need.
So the Oregon legislature mandated 3 audits of the Measure 110 program, and this was the final one. From 2022 to 2025, the audit found programs receiving Measure 110 funding reported 3 million encounters with people in need of addiction support services. 3 million. For context, the entire population of Oregon is around 4.3 million. And just to hammer home the apparent lack of results here, let's just take a look at a few of the audit questions and what they found. Okay, first, is the current system functioning to support a public health approach? The answer, no. Question 2, are state grants and funding supporting behavioral health services in an effective and equitable way? No. Question 3, do investments into Measure 110 programs contribute to measurable reductions in overdose rates? Can't determine that one because of a lack of data, even though it was something past audits specifically called for. And question 4, has access to services like behavioral health, treatment, and housing improved since Measure 110 passed in 2020? Can't answer again because of incomplete data. But in defense of the Oregon Health Authority, the report notes that Oregon's addiction problem is decades in the making, and because of that, will likely take decades of effort to fix. Okay, now it's your turn to weigh in. What do you think about what the audit had to say about Measure 110? Were you surprised? Why or why not? Email the story at kgw.com or call and leave us a voicemail. 503-226-5090.